Moving on to the metabolic acidosis causes with an anion gap now. An easy way to remember this is by the mnemonic gold mark. G for glycols, like ethylene glycol or propylene glycol. O for oxoproline, which is a toxic metabolite of acetaminophen. L for L-lactate in lactic acidosis. D for D-lactate in exogenous lactic acid. M for methanol and other alcohols. A for aspirin, specifically the late effect of aspirin. R for renal failure. And K for ketones, which can be from diabetic ketoacidosis, alcoholic, and starvation states. So basically, the loss of something that is other than the chloride and not in the anion gap calculation that we talked about earlier. Now let's go through each of these. Ethylene glycol. This is metabolized to glycolate and oxalate, which destroy the kidneys, so they have very slow excretions. Propylene glycol is metabolized to pyruvic acid, acetic acid, and lactic acid, and causes the high anion gap metabolic acidosis from the lactate. Lactic acidosis occurs when there is low oxygen delivered to the body tissues. In this, pyruvate is converted to lactate and causes lactic acidosis, and therefore an anion gap metabolic acidosis occurs. M for methanol. This metabolizes to formic acid, and this is a CNS, central nervous system poison, and it can cause a visual loss and coma and found in many industrial products. It can either come about by ingesting it accidentally, a suicide attempt, or an alcoholic who can't find any alcohol to drink. This causes a high anion gap metabolic acidosis. Next, we have aspirin overdose. This causes two acid-base disorders. First, shortly after the ingestion, there's respiratory alkalosis because the body starts to hyperventilate. And the second is hours after ingestion. Anion gap metabolic acidosis occurs here because of inhibition of the citric acid cycle and accumulation of pyruvate, lactate, and keto acids, which can all lead to acidosis. Because it has two disorders that can come about from it, the pH can be variable. Carbon dioxide is low due to hyperventilation, and bicarbonate is low due to acidosis. So here we can use the Winter's formula, which predicts the carbon dioxide, and we see a lower than expected carbon dioxide. Now, for example, if we have a pH of 7.2, a partial pressure of carbon dioxide of 21, and bicarbonate level of 14, now this is a metabolic acidosis. And then we use the Winter's formula to determine the expected carbon dioxide. So in this case, 1.5 multiplied by 14 plus 8. This is equal to 29 plus minus 2. And the actual is 21, which is lower than the expected 29. Because the aspirin causes the body to hyperventilate, this is showing a concomitant respiratory alkalosis. This is commonly seen in a patient with aspirin overdose, and this is commonly asked about in the exams. So make sure you understand this a little bit more clearly. Next, we have renal failure causing uremia, advanced kidney disease, because kidneys then cannot excrete organic acids, so you retain the phosphates, sulfates, urates, and other anions, and this increases the anion gap acidosis. Next, we have ketones, diabetic ketoacidosis, which usually occurs in type 1 diabetes. Now, the insulin requirements rise, And then the fatty acid metabolism causes the ketone bodies an increase in unmeasured anion release. So the high anion gap metabolic acidosis is from the high levels of ketones. Some other causes that may come up in your exams include iron poisoning and the use of isoniazid. Iron poisoning. The reason you get an anion gap metabolic acidosis is from the ferric ions, which are unmeasured anions, and also lactate from the hypoperfusion of the tissues. Isoniazid is an anti-tuberculosis medication, and an acute overdose can cause seizures, which may cause lactic acid buildup because of the anaerobic metabolism of the muscles. So this was a rundown on the high yield points of metabolic acidosis that should keep you prepared for any questions on this topic should exams be around the corner. I hope you guys enjoyed this video and keep a lookout for the next one. Thank you for watching sqadia.com.